All right, Andy Schoonover, welcome to the Chasing Curiosity Pod. I really appreciate you coming on.
Yeah, thanks for having me. Appreciate it.
Absolutely. As I mentioned before, we just recorded, been following you and what you're building for a while now. And I think the company that you're building is definitely one of the most interesting companies I've seen in a while, but also can be one of the most important ones moving forward. And what I'd like to start out with, I think a good jumping off point is a tweet of yours from a little while ago that I just loved, which
Oh
is
boy.
I'm passionate about blowing up the healthcare system so everyone has access to fair prices, the monetary system so everyone can keep what they earn, and the food system so everyone can play in the backyard with their grandkids at 80 years old. That's why I started Join Crowd Health. And so let's start with the healthcare side of things. That's obviously the main realm that your company plays in. Why does the healthcare system need to be blown up?
Yeah, I mean, I think that one, it's a massive, massive industry. It's I think 4.6 trillion is the forecast for 2024, which I think would put it as if it was a country, it'd be the fourth largest GDP in the world. I think it's after US, China, and Japan. And I think it's catching up to Japan. So, I mean, that's how crazy large this is. And the only reason I say that is because there's so much money in that it's very, very difficult to change, right? It's difficult to take the Titanic and get them to change in a big way quickly. And so with that, I think there are also too many perverse incentives. And so if we're trying to take food off of people's table, meaning that get fewer people getting paid by this massive system, it's nearly impossible to change it. And so I said we just got to burn it down and try again, burn it down, start again. I don't think we can get much worse. I think in terms of the cost per resident, the United States is like twice as high as the next country. So we're spending twice as much on healthcare and getting really poor outcomes in terms of life expectancy and things like that. It's just all around screwed up. So let's burn it down and try it again. I kind of joke. I don't want the ATFs, visiting my house. But it's an analogy where ATF guys. So yeah, I mean, I think that there's just no redeeming qualities of it currently. So we just got to burn it down and try again.
It's kind of unbelievable when you think about just some of those numbers that you threw out there. And you would think if we're spending the fourth highest amount, GDP in regards to countries, you would think we'd be a super healthy country and be
Hmm.
getting just the best quality of care that there can be. But it is the complete opposite of that, pretty much. We're getting sicker, quality of care is getting worse. How did we even get to a point that it became this? Is it just truly bad incentives that has led us to this point where obviously people call it sick care rather than health care? That's where you get your money from.
Hmm.
And on top of that, do you think it's deliberate in a way? Where is it, I don't want to say bad people, but a bad system operating for profit system and people are just kind of trapped? Or just kind of you visualize
Hmm.
the entire just industry as a whole?
Yeah. I mean, I think there's a lot there, and there's a lot of like intertangled webs with medicine, food, money. And that's why I'm kind of passionate about changing all three of those. And I think it started back in, the 1970s where the HMO Act, I think it was 1973, came into effect, which is basically codified in law our current healthcare system. Around the same time, we debased from gold. And so there was this liberalization of our government that, you know, allowed companies and the government to be a lot more involved in our day to day lives. And that started back in the 70s. And the casualties of that are significant. Diabetes went from 1% of the population to 10% of the population. So we're 10x over the last 50 years, our diabetes. About a quarter of our dollars, our healthcare dollars, are spent on diabetics. So every dollar you give in premiums this month, about 25 cents of it is going to diabetes or people with diabetes. I mean, that is the craziness of our system. And we've gotten to the system where, we were just talking about before we got on the meat mafia guys who I love what they're doing, trying to change the food system is we debased from the dollar. We introduced highly processed foods into our system, which then made us sicker, which then made the pressure on the healthcare system. And because we were debased from the dollar, then we just had the incentive of give people more and more healthcare without any ramifications of that, at least short-term ramifications of that. We're seeing long-term ramifications of that now with inflation and things. But these things are all kind of stacked upon each other, and it all happened in the 1970s. I think it was 13, 14 years ago, we had the Affordable Care Act, which is supposed to say, okay, well, we see some bad things happening. Let's change it. But unfortunately, it was changed by a bunch of bureaucrats, which actually made the system more bureaucratic and less efficient. I'll give you one example. In the Affordable Care Act, they said that health plans can only make 15% of premiums in profit. So the bureaucrats in DC, they're like, of course, we don't want these health insurance companies gouging people and reaping too much profit and all this kind of stuff. And so we're going to limit the amount of profit that you can get from premiums. So if we just do some quick math, let's just say we're paying $1,000 of premiums, the health insurance plans can only make $150. Okay, so that doesn't sound too bad. That sounds reasonable. But these are all for-profit organizations, or if they're nonprofit organizations, they act like for-profit organizations. And so how do they grow their revenue from, $150 by 10%? So to go $165, well, guess what? Your premium has to go from $100 to $1,100. And so what they did is they have this rule, this new law that's supposed to do one thing, but given that none of them have actually been in the business world, don't fully understand the second order ramifications of this, which is now the health plans actually have an incentive for prices to go up. They're supposed to be our agents. They're the ones that are supposed to be out there trying to reduce prices. They're supposed to use all of us as leverage against hospital systems to reduce price. But in fact, they actually have the exact opposite incentive. They want to see prices go up over a period of time, right? So it's the continuous government intervention in our day-to-day lives, I think, under the kind of the auspice of like, oh, we're going to protect you, our people, but instead, they're creating great bureaucracy, which has led to inflated costs and really poor outcomes and obesity and reduced, life expectancy. I mean, these laws have taken people's lives in essence. And so that was a really long-winded story because it's so intertwined to what's going on. But I truly believe that healthcare, the food system, the monetary system, all work in coordination with each other, and they've all been screwed up over the last 50 years. And now we're seeing the ramifications of that.
It's such a complicated just system as a whole, even if it's just siloing it to healthcare. Like to actually understand how it all works is extremely complicated. So why did you choose to, take on this burden of trying to figure out how this all works?
Yeah. Just one more on that previous thing, which is another crazy stat I realized the other day. The top 5 largest insurers in the United States, their revenue is larger than the U.S. military budget. So the U.S. military's budget is almost $1 trillion. I think it's 950, something like 950 billion. The 5 largest health insurance plans have greater than $950 billion of revenue. They're larger than the entire military, it's just incredible to me. And then, why did I do this? It's a great question. This is my second healthcare company after the first one. I was like, I'm not doing this again. Like, this is so brutal. And in fact, I was selling into health plans in my previous job. And one day I walked into the chief medical officer office of a very large health plan. You would know the health plan. I'm going to keep it under wraps for now so I don't get sued. But I walk in and I'm trying to sell him something to reduce the cost for diabetes, basically something to monitor their blood sugars. And so that nurses could get involved if their blood sugars were too high. So it's remotely monitoring their blood sugars. And the chief medical officer looked at me. This was to a commercial plan. So these are plans that, companies have, right? And I was like, hey, you can save a lot of money on these diabetics and yada, yada, yada. He's like, literally, he says, F them. They don't lose limbs until they get into Medicare. Right. So
Mhm.
in essence, what he's saying is they're not our problem. They're Medicare's problem. So when they get to 65, then they'll have all the costs. It's not on us anymore. Right. And this is before a big influx of Medicare Advantage. But that's how people were thinking about this. I just came away from that like, ugh, like this system is so screwed up that I was trying to sell something that was going to reduce cost and they didn't really care. Fortunately, the company did great, but I was never going to do it again. And then I, I sold that company and I didn't have health insurance because most of us get health insurance through our company. And so I had to go on healthcare.gov because I thought it was my only option. And my little one, who was one at the time, was having recurring ear infections. And so we went to the ear, nose, and throat doctor who's like, oh, yeah, she's got a hole in her eardrum. You got to get tubes in her ears. In essence, they put tubes in there, two tubes in her ears so that the fluid could drain out of her ear so it wouldn't put pressure on them. And in essence, what happened is her eardrum popped. And so you got to get tubes in her ear. So we went and did that and got the bill as $8,000. I'm just like, holy crap, $8,000. And it was a 15-minute procedure. It was super easy. $8,000 for 15 minutes, which is nuts to me. And I was like, all right, well, this is what health insurance is for. Like, this is the whole point. And I got a bill, or excuse me, another letter from the health insurance plan. And they said, medically unnecessary. And so we're not going to pay for it. So I had to stroke an $8,000 check to the local hospital to fix my daughter's ear, that was apparently medically unnecessary according to the health plan. And at that point, I was like, screw this, man. I'm out. So I've been uninsured since I think 2020, it might have been 2019, but 2019, 2020, something like that, and started figuring out like, is there a way to operate out without health insurance, given this is so screwed up, and started building some tools. And, the culmination of that is the current company I'm running, CrowdHealth. So I kind of got forced back into it. I didn't want to do it, but it's like one of those things where if you're an entrepreneur, right? Like you see a pain point, you're like, somebody's got to solve this. So when I went to my wife, I was like, I'm doing this again. She's like, no, no, don't do it again. But here I am. But it's been a blast. Actually, we've had a ton of fun.
And just to try and like get a bit of understanding, why does that cost $8,000, that 15-minute procedure? And just again, like, why does any procedure like that cost so much here compared to you name a country that is, significantly lower?
Yeah, it's a great question. I could go a bunch of different ways with it because there are so many different answers to it. One is we have a consolidation of hospital systems in this country where the hospital systems are basically buying up all of the other doctors' offices and pretty much everything, right? So I live in Austin. There are two hospital systems in Austin. And so even if the health plan wanted to negotiate with the hospitals, they can't because it's a duopoly. And if you want to provide service to Austin, growing city, everybody wants to be here, all that kind of stuff, then you have to have both hospital systems. And if you don't, then you're screwed. And so the hospitals are like, I can charge whatever I want, you know? And so that's what's happening on one side. But I would say there's a more structural issue here too, where these hospitals try to do everything within the hospital. Think of it as, I'm making this up on the fly, so this may not be a great analogy. I'm working on it. Like let's just say you're building a factory, right? What is more efficient if I build the same part over and over and over and over and over again, right? Is that more efficient, or is it I'm building 2,000 parts over and over and over again? The one part is going to be way more efficient because I
Mhm.
can get volume and scale and all that kind of stuff. Well, the hospital is trying to do 2,000 parts at once. And so it's wickedly inefficient in the way that it does that. You have these massive $1 billion buildings that you have to now, support. And so of the $8,000, I think 6,000 of it was just the operating room in which we did the operation. I think the doctor got like $200, the anesthesiologist got $200 and whatever. The rest was supplies and all that kind of stuff. So there are interestingly surgery centers now that are being created, which are standalone surgery centers that specialize typically in one or two things. There are birthing centers now that just focus on births, and those can provide the exact same service, same doctors, same everything, just outside the hospital for about 50% less.
Wow.
So, if it just shows the inefficiency of the hospital business model, and it needs to be broken up, burned down, and really specialized. You should be able to go to a heart hospital for your heart stuff. You should be able to go to a birthing center for pregnancy stuff, and you can do it way more efficiently that way. It's counterintuitive, but that's just operationally much easier to specialize.
And has our system always been just, kind of your one-stop shop, or did it used to be more specialized and just consolidate over time to where we are now?
Yeah, I mean it's the big meaty procedures have typically been one-stop shops in hospitals. And then as the technology improves and you can start doing more stuff, you say, hey, in addition to doing X, Y, and Z in the hospital, let's add this new heart procedure in the hospital. Let's add this new brain procedure and this new other procedure. And it ended up being just kind of a cluster of random surgeries with the only thing that they have in common is an anesthesiologist, right? And the need for an operating room. It has been kind of built over time where hospitals are trying to find the highest revenue procedures. And if they have a high revenue procedure, they stick it into the hospital and say, okay, now we can provide this. And so it's just a wickedly inefficient thing.
Mm.
And by the way, more people die in hospitals from errors than almost anything else. Like it's not only a high cost place of doing things, it's very difficult to keep infections from spreading throughout the hospitals. So it's a bad deal.
Yeah, I heard a crazy stat the other day. Malpractice is top 3 or top 5 cause of deaths in the medical system.
Yeah, I think
Um,
that's right.
and it's just absolutely insane to think about again when you think about the price that we pay. And it's a shame because like a lot of medical nowadays is like magic. It's incredible what we can do and how to help people. But it is inevitably just a system that wants to keep everybody involved or in a circle of it, keep coming back. And so while there are things that are obviously great about it, I think what's the stat? 3% of that 3.4 trillion is preventative and it's completely backwards, but it comes back to incentives and leading into incentives. The food system has a big part to play with that. Do
Hmm.
you feel that there's like a deliberate decision on both of the food system and the healthcare system to have the outcomes that we have on a regular basis?
I don't think it's deliberate. I don't think they're consciously saying, I want to, feed people bad food. I think what they're doing is they're rationalizing as a result of some, a monetary incentive. The good book says the love of money is the root of all evil. And so we all love money in some way. And so if there's an incentive to make more money, then we are very good at rationalizing why we're doing what we're doing. And so I think that a lot of that is just a rationalization, not because we have really bad people who want to make people sick. I just don't see that. I mean, I generally think people are good. But again, it comes back to the perverse incentives of things. I mean, we see so much money in pharma, especially. We see pharma, and this has come out recently. Like, we see pharma being like one of the largest advertisers on TV, and therefore people are afraid of coming up against pharma because they're afraid their ad revenue is going to get slashed. And so you can't say anything bad about pharma. You can't have guests on that question pharma. And so that is a love of money type of issue. Now, are they deliberately, wanting to not do that? Like, it's just one of those weird things. I think it's just like, okay, we won't say anything bad about pharma or else we're going to cut our revenue, even though we disagree with them. I think we're seeing a lot of these large healthcare organizations like The American Diabetes Association, for example, is funded a lot by food and pharma. And so, an organization that is supposed to be out there defending and helping people with diabetes is coming out and saying like high carb meals are fine and all these kinds of things. Well, guess who's given a diabetes association, like the insulin providers and the food companies and things like this. And you're just like, this is crazy town. It's crazy. And so, and I think it's evil in many ways, but oftentimes evil is masked as good, and you can't peel away the layers to find the evil underneath, because you're so rationalizing the decision based upon having to put food on the table for your family, right? It's just so freaking perverse that it's a sad thing to see. And you see it all over the healthcare system, like American Diabetes Association, American College of Cardiology. All of these are impacted by these perverse incentives, and they are directly impacting what doctors are telling us to put into our bodies, and therefore we are getting sicker as opposed to healthier, which is the mission of these organizations. It's a sad state of affairs.
I think a lot of people don't quite understand just that, what you were just talking about, of who is funding what, even in regards to different studies or different associations, where at the front of it, the look of it looks great. They're like, oh, this company is goal is to reduce childhood obesity. Sounds like a great mission. Then you look at like the board members or who's funding it. It's Pepsi, it's Coke, it's
Yeah, exactly.
Nestle, it's, then we can go into just the food system as a whole. It is 7 companies that were, I forget the number, 7, 8, that control the overwhelming majority of the brands.
Yeah,
And again, if you just think back, look to incentives, it's like their goal is to maximize profit. So their goal is to get you to buy as much of their food as possible. And
yeah,
I think, you're obviously an entrepreneur yourself, and so am I. And so, like, we don't necessarily like profit. Capitalism isn't the problem. And there's a way that you can use the system as is to fuel it in a healthy manner. And so, what is your goal with to take a company that needs to make a profit, and goal is to make profit, but use it for the sake of good and making a healthier population rather than the current system that we and players that are currently in it?
yeah. It's a great question. My previous company went really well, so this is not for the money for me. I sold my last company for over $100 million, so this is not like a thing for me where I'm trying to make the most money as possible. It really is like I'm heartbroken by the fact that we've got 200,000 families every year going bankrupt due to medical expense, even though they have health insurance. That is ridiculous. That's ridiculous. And so nobody has gone in debt. Nobody has gone bankrupt on CrowdHealth over the last 3 years since we started the company. And so I was like, man, that's awesome. And so, yeah, I mean, I don't have any real monetary goal with this. I think my goal with this is like give everybody in this country a true alternative to the current medical industrial complex, and to set up the company to survive without getting into the perverse incentives that is just so abundant within healthcare. So I've set the company up so that there are no perverse incentives, that my incentives to make money and the community's incentives are totally aligned. Health insurance plans, you put out premiums, and then they make claims, pay claims. The delta is how much money that they make, right? So that in the short term actually incentivizes them to deny claims. And so if they deny claims, they make more money. Like it's just a weird incentive. And I already talked about the medical loss ratio in the Affordable Care Act is at 15%. And so that's a perverse incentive. And so it's like, can you build a company that does not have any perverse incentives so that it can expand and grow profitably, provide a great service, and live a really long time. Like that's really what I want. And I get fueled by people from our members who write into us on a daily basis being like, I'm saving $1,000 a month, or I'm saving $1,500 a month. Thank you for starting this company so that I can save a lot of, money, and I can send my kid now to, private school or something like that. It's like those types of things. And I'm like, man, this is awesome. And that's my primary goal with CrowdHealth. We're trying to get to 100,000 members over the next 3 years. I think that's very, very reasonable. If we can get to 100,000 members, then, we have shown people that this is a viable way, a viable alternative to, to having health insurance. And I think if people really have a viable alternative, nobody loves health insurance. Everybody hates it with passion. I think I saw a Gallup poll. I think it was Gallup, and it was last year, 2 years ago, maybe something like that. It's like, what was your worst, most hated industries, right? Government was number one. I didn't even know that was an industry. I didn't even know you could choose that as an industry, but government was number one, which I agree. Pharma was number two. Healthcare, health insurance was number three, and cable services was number four. So, 2 and 3 on that list was pharma and health insurance. And I'm like, man, if we could take down those industries, like that would be just an awesome thing, or at least be like the seed that was planted that's going to grow, so big that it's going to take down health insurance as we know it. Like what a beautiful thing that would be. So, that's my goal. It's less monetary and more missional. And, I always say like, I hire missionaries, not mercenaries. I want people who are like fired up about changing healthcare, and, and if that happens, they'll make a lot of money, which is awesome. But I want the primary focus to be on changing the system.
I love that. And that's why I said at the beginning, I think it has the potential to be one of the most important companies over the next 10, 20 years, 50 years. But just to give a little bit of context for listeners, CrowdHealth is a crowd-funded health company where each member pays a flat rate per month, and then a extra X amount depending on a couple variables that basically helps other people fund their medical bills. And if you have a bill that you need help with, other members will help you as well. Is that a good kind of summation of it? And what do you want to add to that?
So let's do the payment structure first. It's just a subscription to CrowdHealth, and you pay me $50 a month per person. And so if you have a single individual, it's $50 to me. And then we will ask you to help somebody else out for up to an additional $135. So let's just say Nick breaks his arm, it's $5,000. So we'll go to whatever, 50 people and ask them for $100. And if they say, yeah, I'll help Nick, then we have our system set up so that they open a bank account when they start CrowdHealth. And so they deposit $100 into the bank account. $100 goes from their bank account to Nick's bank account that he set up with CrowdHealth. And at the end of the day, Nick now has $5,000 to go and pay for his broken arm. And, that takes a few days to totally work. And 99.8% of the time, we're able to fully fund our members' request.
Incredible.
The cool thing about Nick now having that $5,000 is he can go to the doctor and say, hey, I'll pay you in cash at the point of care. And as a result of that, we're getting way better pricing. Our members are getting way better prices than what the health insurance plans will pay. And it was like, okay, why is that? Well, one, you don't have the bureaucracy of having to bill a health insurance plan. Billing a health insurance plan is about 20 or 30% of your revenue goes to just billing, in which the friction of that is ridiculous. And you have to wait 2 or 3 months to get the money. So if I can get you the money now, and I can save you 20 or 30% by not having to bill health insurance, these doctors are like, yes, please, like give me cash. Like I'll do that. And so these prices are significantly better than health insurance plans. And that's kind of the crux of why this works. Better prices in cash, eliminating the middleman. And it's worked, over, I think we're up to 17,000 bills or something like that have been submitted. And like I said, 99.8% of them that we we send to the community have gotten fully funded. So it's working really, really well. These are, from $69 virtual care visits to hundreds of thousands of dollars worth of a bill due to cancer cases and car crashes and boating accidents last summer and brain hemorrhages, all kinds of stuff we've sent through the system. So it works pretty well for the small stuff and the big stuff, which has been fun to see.
That's incredible. How does it work where, back to the example of 100 people paying $50 or $50 for
I think I screwed up the math. 100 people paying or 50 people paying $100. I
yeah,
think is what we probably should have said.
yeah. Yeah, I don't like to do public math, that's why.
So yeah,
Uh,
exactly.
but back to that example, how are those 100 people chosen out of all the members? What's that kind of
Yeah.
just process look like?
Yeah. We ask people once a month. So
Mm,
we'll ask you if you're a member of CrowdHealth, we'll ask you once a month, and it's round robin style. So it's if you're the first in line, then you're gonna be the last to be asked on the next time around. So it's just kind of like a round robin style. And so everybody gets asked once a month. And so it's a pretty equitable, distribution of funds. So you'll get asked around the same time every month. So just to try to keep it easy on your budgeting, but it's a max, right? So if you're an individual, you're giving $50 to me and then up to $135 to Nick for his broken arm. In our 3 years, we've only asked for that max twice
mm,
because the bills have been lower than that 135 needed. But we can scale up to 135 when the big bills come in, and then we can scale back down when there's no big bills in. So you get to keep the money in your pocket. So for example, in July of the 135, we only asked for 60. So you got to keep the remaining, what's that? Here you go, public math again, $75, in your pocket. You can do whatever you want with it. And so instead of the health insurance plan holding on to it, you get to hold on to it.
mm.
The better the community does, the better you do. Right. And so you build this community component of it that's like, hey, we want to do well because we want to save money. I have a direct incentive to ensure that people are doing this right because it does impact me directly. So
Yeah,
definitely way different than health insurance. I'll say one other quick difference between this and health insurance is the majority of my money is going directly to another human being. Like it's not going to United Healthcare where I have no idea how they're spending it. They could be spending it on a lobbyist. They could spending it on CEO, big pay. They can spend it on a million different things. This is like, I know that my money is going to, I don't say Nick, but I say to a male who lives in, where do you live?
Jacksonville, Florida.
Jacksonville, who broke his arm. It's like, that's cool that I actually get to help somebody directly.
Mm,
We had somebody who, I mentioned this before, last summer, we had somebody who was in a boating accident and got her, Abby is her name, got her fingers cut off in a boating accident,
mm.
19 years old. And so we sent that around and these bills were monstrous, as you could probably imagine. And we had people come back to us and be like, hey, instead of $100, can I give $200? Because I can't imagine what Abby is going through. Like you would never in a million years call United Healthcare and say, can I give you more this month? But if you're actually connected directly with a human being without any middleman, like if money's going from you to Abby, like there's something human about that. And so we actually say like fund humans, not health insurance.
Mm,
It's kind of our little motto because it's a totally different way of doing things. And I kind of call it back to the future because back in kind of the agrarian society that we all kind of came from, if somebody in your community needed help, there was no middleman, there was no government, there was no health insurance company. It was like the community had to rally around these people and help them. And there's a beauty to that. And I think, especially over the last 50 years, like government and insurance companies have wedged themselves in between me and Nick so that I don't feel like I have to help Nick anymore. Like there's no direct connection there. And so because the insurance company government has broken that connection between us and our neighbors. And I think we're seeing that play out in culture where it's way easier to hate somebody else if you're not in a community with them. And so we're just seeing kind of the disease of that's in our culture because it's just hate. It's easy to hate somebody. So Anyway, that's my long rant on like the lack of community in our country right now, the lack of generosity towards people that are our neighbors. Before, like I remember in the 80s where somebody moved in next door and you'd take cookies to them, like these are in your community. It just doesn't happen anymore in most parts of the country. Some parts of the country does, but most parts of the country doesn't. And I'll be honest, if somebody moves in next to me, what is the first thing I think about? It is, what did that person sell their house for? That's directly indicative of how much my house is worth. Right. And like, that's how warped our minds have gotten towards our neighbors. And so, in a little way, CrowdHealth is trying to change that to be like, no, 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 we're in a community. We live and die together. And so I think that's a pretty cool thing. And if you want to call it socialist or whatever, that's bullshit. This is like good people who take care of themselves, who take on personal responsibility. Like those are the people that I want in my community. And if I need help, then like I'm more than willing to help Nick, who's personally responsible and takes personal sovereignty and, eats well and exercises and takes care of his shit. And like, that's the guy I want to help, not United Healthcare. He doesn't give two shits about me as Andy or my family. Right. Like that's what I get fired up about. And so it's maybe back to your question of why I do this. Like I get fired up about, like making a difference in the communities. And if CrowdHealth can do it in a really little, a small way, I think that'd be super cool.
That shared buy-in is super powerful, and I'm sure attracts a certain kind of person who is wanting to be self-sovereign, who's wanting to and willing to take control of their own life and be responsible and, like you said, exercise, eat right. And so would I be kind of spot on that? It's like a very, if you looked at, let's say, entrepreneurs, I'm sure there's a bunch of entrepreneurs. I'm sure there's a bunch of athletes.
Our number one characteristic is entrepreneurs. So you're an entrepreneur, you're a solopreneur, you're a gig worker, but in essence, you're running your own thing. That's our number one group. Number two, and interestingly, is medical professionals.
Wow.
No, I think it's people who like see
See the
the
belly of the
system is
beast.
really broken and like, yeah, we need to change this. So those, and then, it's slightly skewed male 60-40. It's slightly skewed signal 60-40. Although we're actually beating on families now, or as of the last couple of months, and it's people that kind of fall into three main categories. And I think it's probably, as a result of me being passionate about this. And it's where I want to go and talk about this, but it's our healthcare system is broken. So we got a lot of people who are into like holistic, naturopathic, integrative, functional medicine. So it's kind of like an anti-Western medicine, anti-pharma. Let's focus on the root cause here as opposed to just treating the symptoms. So we get a lot of those people. We got a lot of people in the kind of the food world who are trying, like the meat mafia guys. We got a lot of carnivores, a lot of keto people, a lot of people who are looking at what they put in their body and being very suspicious of things that come from big food, that are suspicious of things that are processed. And so we got a lot of those people who are, very kind of whole food oriented. And then the last one is we got a lot of people who are anti kind of the way that our government deals with the financial system. As I told earlier, like these financial and food and health all kind of are intertwined. And so we got a lot of like Bitcoiners who are joined. Probably a third of our customers, maybe even more than that, are Bitcoiners. And so I think we have a lot of people who are kind of taking a contrarian look at, big kind of components of society that they feel like, our culture is just getting kind of like psyoped into thinking that this is normal. Like you have to have health insurance. You have to go to Western medicine doctors. You have to eat processed foods, all this kinds of stuff. I don't know if I forget exactly what it was. There was a study that came out and it was like, what was it? Lucky Charms or something like that was
Yeah.
like better for you than,
Red meat. And,
a ribeye. And I'm
yeah.
just like, if this is not absolutely ridiculous, I mean, I don't know why. I don't know how people cannot see that and be like, that is ridiculous, And so we got a lot of people who just like, and looking at this is like, I don't want to be a part of that. I want to be outside of the system. So there's a freedom of being uninsured and being able to go to whoever you want, but also knowing that there's a group of people behind you who, like, if something really big happens, they got your back. So yeah, it's a fun group of people to be a part of for sure.
Is some of the natural path holistic stuff covered? Or like, is that stuff able to get funded through you guys?
Yeah, we'll submit that to funding. Yeah, naturopathic. We're adding chiropractic if it has to do with a medical event. Like if you're going to go to a chiropractor every week just for your thing, like that's something that you should be paying for. Just like you have to pay for your gas for your car and your oil changes for your car. Insurance doesn't pay for that. You should pay for that yourself. But if there's something that is associated with a health event, like busted up my back, and so I need to go see a chiropractor for sure. We're adding acupuncture in the fall. And then, if you want to go to a naturopathic, holistic, integrative doc, you can do that. The beauty of this and why I said it's so freeing is like, you don't have to, you can go to whatever doc you want. There's no networks. And given that they will give you a pretty good discount as a result of paying in cash, it eliminates the need for any networks, which is great because I know for me that when I had insurance, like the number one thing was like, okay, who's in network, who's out of network, all this kind of stuff. And so it's just super freeing to not have to worry about that.
I'm sure, especially families have kids and are trying to constantly just think about and decide on where they can go and to the point of in and out of network. Just like the added stress that is putting getting put on
Yeah.
you, like is making your health worse in that process. And so just beyond the actual system itself, just the system itself is stressing people out and making people more sick than it needs to be because it's so complicated.
Yeah. Absolutely. I mean, the complexity, quick funny story is I went to Stanford for business school. The number one guy in our class was my roommate. And I was talking to him. He's actually an investor in CrowdHealth too. I was talking to him and he's like, there's two things that make me feel, really, really stupid. And number one thing was health insurance explanation of benefits, right? It's like you get these things in the mail and you're like, how the hell, like, did you come up with that? Like the math doesn't even make sense. This is like addition and subtraction. And then like, it's not right. Like I can look at these two things and that doesn't add up. And so, just relieving people of having to deal with the explanation of benefits, which don't explain it a whole lot at all, is one of the benefits of Crowd Health. So you have like one of the smartest guys I know who look at health insurance and is like, I don't get it. It's too complex. It's very easy to look at a bill and say, okay, it's $100. I can pay it with a credit card, like be done with it. There's no EOBs in Crowd Health, which is just so much easier than having to do it through a health insurance.
It's truly like unbelievable if it wasn't real, if you didn't see it for yourself,
Yeah.
somebody just like told you this in a far off land, this is how things work, especially in a country that's supposed to be as developed and amazing as America is. And obviously the US is amazing in many different ways, but we have a lot of things very broken as well.
Yeah, exactly. Exactly. And one of the things I do want to say, like, we have like the best doctors in the world. If you have a complex case going on, like you want to be in the United States. Like there's no doubt about that. Like I don't want to like diss our entire system because, the Saudi royal family has floors of hospitals reserved for just them in New York because they want to come to the United States to deal with their really complex cases. So if you have a complex case, you want to be in the United States. However, if you look at the actual outcomes, they look terrible. And so you have to say, okay, so why is that? Well, obesity is such a cruel, I'm going to call it a disease because I think it is. It's such a cruel disease that everything that happens with you in your healthcare is exacerbated as a result of your obesity, right? So if you look at for example, like knee replacement surgeries, the outcomes from knee replacement surgeries in the United States is really bad. Why? Well, if you have somebody 400 pounds, that knee is not going to do as well if you have somebody who's 180 pounds, right? Like a knee is not constructed to hold 400 pounds. But given we have such an obesity problem in the United States, that makes it worse. everybody loves to look or hates or to look at like maternal mortality or even fetal mortality. But you know what? If you look at the data, all the moms who are dying post birth, almost all of them are obese. And so as we have the obesity, which is exacerbating all of our costs. And one of the things with crowd health is they're like, look, if you're over 260, you're not allowed in crowd health. You have to get under 260 unless you're 6'5" and you're jacked or something. Like we make some exceptions. And so we're trying to incentivize people to be healthier. And I think the best way of doing that, per kind of our earlier conversations, everybody's incentivized by money. If I can make it less expensive for you to take care of yourself, then that's a great incentive for people to actually take care of themselves. So yeah, it's a bad situation. Part of it's the system. A part of it is just we have such horrific habits within this country. It makes our system. It puts a ton of stress on our system too. So bad all around.
Yeah, it really blows my mind. Truly, it truly does that every day. Obesity isn't the number one topic talked about by the president or government or just like front page news of 80% of people are overweight, 40% are obese. In the next 10 years, I think it's up to be supposed to be up to 50% obese. Like that is truly an epidemic of
Yeah,
mass, no pun intended, proportions that like to your point is just like not just the first order health effects of that, but then the second order, third order, plus productivity of that person, plus, you can go down probably 20 different orders of like how big of an impact obesity has on our nation and our world for multiple different reasons. And again, when you look back to just which I think is starting to shift back, which is good, just the health at any size and things
yeah,
along those lines, like I don't even understand how that can truly be just allowed, to be honest. Like, how does that allowed to be promoted the way it was?
yeah. I don't know. It makes me sad. And I think you're right. I think it is changing a little bit. And look, I'm not at all a fan of like shaming anybody who is obese or things like that. But I also think there's the loving thing to do is to help those folks get back to a size that is healthy because they live on average 10 years less than somebody who is of healthy weight. Like, wouldn't you want 10 years of your life back? And a lot of times too, the last few years are awful. Like they come down with some chronic condition and it's like, geez, that's the terrible way to go. I kind of have said it before, like I want to finish strong. I want to
Mhm.
finish strong and my the last few years of my life, like as you mentioned earlier, like playing with my grandkids in the backyard, playing wiffle ball. That's what I want to do. And you just can't do that when you're 350 or 400 pounds. And so health education is a big component of what we do. I mean, we do kind of monthly specials where our members get access to like DEXA scans, for example. DEXA scan is basically can tell you your body mass, body fat percentage. And then probably the most important one that people don't even know about is visceral fat, which is kind of like that fat that hangs out around your organs. And that's the stuff that kills you. And people don't even really realize that. And so we ask people to get their visceral fat. And so we do a lot of education about what that's like. We do a VO2 max score, which basically is you sit on a treadmill and you run for 10 minutes and it tells you how effectively and efficiently your body is using oxygen. And is the number one determinant of longevity is your body's ability to process that oxygen in an efficient way. So we're trying to teach our members this type of stuff because you don't hear that from anywhere else unless you follow Huberman or Peter Attia or one of these guys on Twitter. So we're trying to get education out there to actually have better like health outcomes for people. And so that's a lot of it's fun to see people realize that, they got something either going on or they're super healthy and they know what metric biomarker to look at to ensure that they stay healthy. So we do a lot of those types of things. Coronary artery calcium scores we did last month or 2 months ago, 3 months ago, something
Mhm.
like that. So that's another one where people, it's great to know if you have plaque buildup in your arteries and what can you do to offset that and things like that. So we focus a lot on education.
That's amazing. Do you guys ever do anything around just like blood markers, whether it's Inside Tracker or any other just blood pooling to get a little more granular on stuff like that?
Yeah, what we do is we allow our members to have one kind of wellness visit, including blood, a kind of a full panel from soup to nuts, everything. And then we give them education on like, okay, what do all these numbers mean?
Mm.
What is what is HDL? What is LDL? What is an A1C? And kind of things that have been not widely accepted, but have been accepted by some of the leading doctors that we follow, and the ones I just mentioned. Here's what you should be looking at on those, and if they're totally out of whack, then that's when you need to go probably see a doctor. And if you're looking for one, let us help you find one who is root cause as opposed to just trying to alleviate the symptoms. So, again, I think we've got a lot of people within the medical industrial complex that want to scare you about a lot of things so that you buy a lot of stuff that makes them a lot of money. That's a challenge. That's a
Mhm.
challenge. So we take a bit of a contrarian approach to some of these kind of widely accepted principles, you know, LDL, things like that, where we think like, hey, there's probably more here to this than what you've been told by the American College of Cardiology. So it's fun trying to educate people on some of the things and how their body actually works. Because most people, vast majority, have no clue. Have no clue what all these numbers mean. So if you can educate them on that, then what is the saying? There's something like whatever you measure changes, or it won't change unless you measure it.
Whatever
And
gets
so
measured gets
something
managed.
something like that. And so, if these people know what they need to be measuring and know how to change it, then that stuff will actually change. I just had my blood panel done yesterday. So it's a normal course of business for folks at CrowdHealth to get that stuff done. I think it's important.
That's amazing. Amazing mission. Then you guys just introduced a couple weeks back a carnivore group or crowd. Is there anything different if you're a part of that group versus just normal crowd health? And do you guys plan on doing any other different groups like that moving forward?
Yeah, absolutely. It's again, we're trying to focus on community. We're trying to focus on community and people who've got a shared mission, a shared community are ones that we like, kind of allowing them to fund each other's healthcare expenses directly. So we've got two crowds right now. One is a Bitcoin crowd. So those people fund each other's bills. Then we've got a carnivore crowd that we're building. And so it's just carnivores that are in that. And to be in that community, you have to actually have another like set of criteria to get into that community. So since I can't sit next to you and ensure that you're eating an animal-based diet, we think that the easiest proxy for that is either visceral fat, which you have to be in the bottom 25% for visceral fat, or a fasting insulin under 5. So typically the carnivores have very low fasting insulin because you're not eating carbs. And so the insulin levels are pretty low and their visceral fat levels are typically low. So if you can just have one of the two of those things, then you can be in our carnivore crowd. If you go above that, which we require you to retest, then you're booted. You're out. You're reaching down for the Cheetos or whatever. Like it's that extra incentive to be like, don't do it. Don't do it. Cause we don't want you to get kicked out of the carnivore crowd. And actually the bigger vision here is like to have 5 to 10 crowds over the next 5 years, each with let's just say 15,000 people in them. We think that's kind of the right way of thinking about it, and all focused on different communities. These might be businesses. I mean, it might be, a big real estate agency, nationwide real estate agency that has 100,000 realtors that don't get health insurance because they're actually 1099s. And those people might want to share. It could be a big fitness organization that's nationwide who have members who feel like they're in community, right? That could be in something. So we think we'll have 5 to 10 of those over the next 5 years. It's worked out really, really well so far.
Yeah, it's really cool. Do you foresee or have you had talks with businesses like that that are interested in like getting a group or just offering something to their 1099 workers or whatever it may be?
Yeah, we're gonna launch actually a couple of them over the next 4 months. So
Amazing.
you'll see from us two, probably two new communities that have been built up, and over the next, yeah, by January 1st, we're gonna launch two new ones.
That's amazing. Then a few personal questions. What's your diet look like?
Yeah, I'm kind of ketovore. I'm animal based heavy. I will, let's see, I just had lunch about an hour ago. So I had steak and cheese for lunch. Made that at home. So that was good. Protein shake for breakfast, and I think I'm grilling steak again tonight. I'll probably add a salad or something like that to it. I'm not against vegetables. I try to keep it without the glyphosate and all that crap that people put on them, and so I try to choose carefully what I put on those. But I'm typically under 20 carbs a day. Maybe even 15. My body doesn't do well with them. I tend to gain weight quickly when I eat carbs, and so I just try to keep them out of my diet. So that's typically where I'm at. Harder with kids. I got two kids, 6 and 8. Harder with them because they're not as much, carnivorous. But yeah, you do your best. I'm not like dogmatic on it. I had a conversation with Dr. Ovadia. Do you know who Dr. Ovadia is? Have you heard of him? He's
I
he's a
believe
leading
so.
cardiologist, heart surgeon who is very much into metabolic health, and he had a really good analogy, which I'll share. It basically what he said, he's like, "Look, if you are poor, financially poor, it makes no sense for you to go out to the fanciest restaurant in town, right? But if you have a lot of money, like if you are wealthy, sure, go to like a really fancy place once in a while, right?" And he used that analogy for saying, like, if you are metabolically poor, like, do not have metabolically unhealthy, meals. He's like, you should not be doing that. However, if you're metabolically healthy, then yeah, I mean, if you want to go have a bad meal once in a while, like, it's not going to kill you. It's okay. It's all right. My kids love pizza, and I have pizza with my kids once in a while. It's just because, like, it's just a part of, like, that experience with them. I don't drink other than on vacation because I love having a margarita with my wife and sitting at the pool overlooking the ocean. Like, that to me is a soulful thing. And if I have a margarita once in a while, it's not that big of a deal. So I think people need to take a little bit more of a pragmatic view on this, just acknowledging the fact that you can do more if you're metabolically healthy. You can do less if you're not metabolically healthy. And so we push metabolic health to our members a lot, saying, "Hey, you need to understand what kind of the components of metabolic health are and whether you're metabolically healthy, because that should be the primary driver of what you are putting into your body." So that's just the approach that I take. I think it's a healthy one. I don't stress too much about it.
Yeah, I love that analogy, and I definitely have been on the far end of things before, of just like super strict and just super just uptight about everything that I put into my body, and it makes life more difficult, less enjoyable. And to your point, is like every once in a while, not a big deal. Even once a week, not a big deal. Again, like the stress you put on yourself about eating a bad meal is probably worse than just eating the bad meal and moving
I,
on.
I believe that for sure. Like, I think cortisol levels go up as you stress about what you're eating so much. Like, and those cortisol levels have a pretty profound impact on your health. Like, don't worry so much about the fact that you had pizza tonight with your kids. It's okay. Like, get back
Mhm.
at it tomorrow. Just the stress that people go through with what they eat is pretty amazing to me.
100%. Then, do you do anything else kind of religiously for your health? Cold plunges, saunas, anything along those lines?
I did cold plunge for the first time a couple months ago. Man, it was hell. It's
It
such
does suck.
hell. It sucks. It sucks. I have not been able to get fully into it. I mean, other than food and just working out, I'm kind of a 5 day a week workout guy. Other than those two things, I don't really do a lot of the cold plunge or the sauna or things like that. My wife actually, interestingly, has become a lot more interested in cold plunge and sauna, and so if I can get her in on it, then that will provide me the incentive of also doing it. Like when you can do it as a couple, it makes it a lot easier than going at it alone. So she's interested, wants to get a cold plunge, so we'll see. But with that said, what the time I did it, like the after effect of that was pretty profound. Like it was a pretty cool experience. I don't know if it was just like my first time and I was like, okay, yes, I did it. Like just the adrenaline from that, or if it was the actual cold that had some physiological impact on my body. I could not tell. I haven't done it enough, but I've heard from enough people that it's a great thing if you can, continue to do it. It's just freaking painful.
Yeah, every single time. I do it every so often, maybe once a month or so. Cause yeah, I just I just hate it. And it
Yeah,
does
I
feel
hate it.
good. It does feel good every single time, but getting in does feel good afterwards every single time, but
Yeah.
getting into it every single time is never any easier.
Yeah. Not for me probably, unless my wife gets me.
It's always better to suffer with somebody else than alone. That's true.
Exactly.
But Andy, I really appreciate you coming on today. This was fantastic. I'll say it one more time. I really think what you're building here is super important and can be one of the more important companies over the next
I
couple
appreciate
decades.
that.
And
That.
new member here today, I will be signing up myself
All
in
right.
shortly.
Awesome. I love it. Well, man, thank you for having me on, and a good conversation. I really appreciate it.
Absolutely. And I end my episodes with the same question I ask everybody, which is, what is your why? Why do you do what you do?
Yeah, my why is pretty clear. If I haven't made it super clear so far, I mean, I want people to get into their 80s and play in the backyard with their grandkids. I want our members to finish strong as
Mm.
opposed to having chronic diseases. I want to live hard and die fast. That's what I want for our members. So that's really my mission, and it's you're on mission. You're right, going the right direction if you're having fun. So I've been having a lot of fun. So if anybody's interested in joining us, it's joincrowdhealth.com. It takes like 5 minutes to sign up. It's wicked easy. You don't have to go through like a yearly re-enrollment or anything like that. It's like do it once, forget about it. You don't have to keep redoing it. It's super easy, and our members have really enjoyed it. So we'd love for you to join us.
Awesome. I'll have that linked in the show notes. And if people want to just follow you more of what you got going on, are you active on social media anywhere?
Yeah, I mean Instagram and X are kind of our big ones. So you can find us at Join Crowd Health on both of those. It's not your typical corporate social media. It's got some, a lot of memes, a lot of sass, a lot of kind of contrarian thoughts about our system. So come follow us. I think you'll enjoy it.
Love it. I'll have those linked in the show notes as well. But
Hey,
Andy,
every quarter too, for people who follow us, we give away a cow. Like,
mm,
and so, if you want to follow us, you can get into our quarterly quarter cow contest, and you can be enrolled in getting a free cow. So that's always fun.
perfect. But Andy, thanks again. This was awesome. I appreciate your time.
Thank you.